Hi everyone, good afternoon and welcome to today's webinar. We're going to go ahead and get started. The title for today's webinar is Creating Healthy Food Environments Through Partnerships like Farm to Institution. Thank you so much for joining us today. My name is Emily O'Sullivan. If I haven't had the opportunity to meet you, I am the Corporate Wellness Specialist for the Working Well Initiative. We also have in the web room Jen Wright. She's our Working Well Manager. She's going to be kind of managing the chat pod today and helping to answer questions you have through the chat pod and helping to resolve any IT issues you may have. We also have a guest presenter. Her name is Holly Godwin. She is the South Carolina Farm to Institution Director, and we're really excited to have her today. She's going to be presenting the bulk of today's webinar on the Farm to Institution program and how you can get plugged into that to bring fresh local produce and other local products to your work site. So before we get started, I just wanted to go over some housekeeping items. You can listen to the audio of the webinar either through the conference line, the information's on the slide here, or you can listen through the speakers on your computer. If we have folks that are on the phone line but have not actually joined the web room yet, make sure you go to that Outlook meeting request that I sent and click that link that says Join Link Meeting, and that will enter you into the web room. If you are listening to the audio on the conference line, make sure you mute your phone just to avoid any background noise, and also mute the speakers on your computer to avoid any conflicting timing in the audio. Also want to point out that we do have a chat pod, like I mentioned before. In the bottom left hand of the screen, you should see a little icon that you can click on. You can put any questions or comments there as we go through the presentation today. We definitely want to hear from you and want this to be interactive. We've also got some attached resources for you that I'll mention at the end of the webinar, but we do have the slides attached for you if you want to save those and reference them later. And the webinar is being recorded today, so we're going to post that on our Working Well webpage after, so you can go back and listen to it at a later time, or you can share it with any coworkers that weren't able to join us today. Also, if anyone's having any technical issues during the webinar, you can email Jen at jwright@scha.org. That's jwright@scha.org. So with that, I'm going to go ahead and jump into today's agenda. We're going to start off with some brief introductions through the chat pod so we can get a feel for who's on the call today. I'm going to do a brief Working Well overview in case we have anyone on the call who is not familiar with Working Well. I think we have some new folks with us. And then I'm going to go over the Gold Apple standards and really talk about the standards that you need to meet in order to create a comprehensive, healthy food environment. And then I'm going to talk a little bit about the importance of partnerships, particularly in food service. And then I'm going to turn it over to Holly, and she's going to talk about a little bit more about the Farm to Institution program and how your organization can get plugged into that. And then we'll have a time for questions and answers at the end. So right now, if everybody would just introduce yourself through the chat pod, tell us your name, your title, and the organization you're with. And if you can, just give us one example of how your organization has implemented healthy food options. That could be a farmer's market, produce delivery service. It could be healthy options in your cafeteria or maybe a healthy food policy. We'd love to hear what you guys are doing. Looks like a couple people are typing. And if you haven't started to implement anything towards a healthy food environment, that's great too. We're glad you're here. Kelly Price is here with Baptist Easley. Got some folks from the Department of Public Safety. And as those answers are still coming in, I'm going to pull up a poll question to get us started. Again, just to give us a feel for who's on the call and what types of organizations are being represented. Please just select the sector that most closely represents the type of organization you work for: hospital, business, state agency, nonprofit, higher education, or K through 12 school. Looks like so far we mostly have hospitals. You guys make sure to answer the poll. Got some state agency folks. And I'll keep that poll open just for a couple more seconds, so get those answers in. All right, so it looks like we mostly have hospital employees with us, and then some state agency employees, and then also some not-for-profit folks. So thank you guys for joining us. I'm also going to pull up a second poll question. This is just to get a feel for the types of things that you're currently implementing to create a healthy food environment. So just select the ways that you promote the consumption of fresh, locally grown produce and other local products at your work site. And keep in mind that you're not able to select more than one option. So if you are doing more than one of these things, just select that option that says more than one of the above. So farmers markets, produce delivery services, on-site gardens, using locally grown produce in food service venues, more than one of the above, or none of the above. Okay, great. So it looks like some of you guys are already doing some great things, and we're going to talk more about these methods a little bit later on, and Holly's going to talk a lot about them as well. Okay, so moving on with the agenda. I just wanted to do a brief overview of Working Well. Like I said, I think we have some new folks with us. So if you're not familiar with the Working Well initiative, just wanted to provide some information on that. So Working Well is an initiative out of the South Carolina Hospital Association. We are a statewide workplace wellness strategy, and we focus on key components of healthy eating and active tobacco-free living. And we really want to help organizations establish a culture of wellness where the healthy choice is the easy choice. So not necessarily making the healthy choice the only choice. That's particularly relevant to nutrition, but making sure that the healthy choice is always available and that it is the easiest choice. The thing that kind of sets Working Well apart from some other workplace wellness strategies is that we have a very heavy focus on policy, systems, and environmental change because those changes are often low or no cost, but they're very high impact. Those changes also impact 100% of your workforce, whereas programs and education and things like that, while those things are important, they only impact a portion of your population, those employees that choose to participate in those programs. So we do address programming and education and marketing and communications, but really our main focus is on policy, systems, and environment because that's going to make the strongest impact towards your culture. So the main pillars that we focus on are tobacco-free people and places, delicious and affordable healthy food environments, which is what we're going to talk about today, and access and opportunity for physical activity during the workday. And then we have an overall culture of wellness area that we focus on as well. So we partner with an organization out of North Carolina called Prevention Partners. They work nationally with organizations all across the country, helping them to create healthier work sites. And we partner with them to use their tool called Work Healthy America. It's an online assessment and implementation support tool that all the organizations we work with have access to. So they use that tool to kind of assess where they are. There's 4 modules, tobacco, nutrition, physical activity, and culture. And the assessments give them a letter grade. It also gives them tailored recommendations and action plans that help them to implement evidence-based strategies to create a healthier workplace. And attached with that is also national recognition. So once organizations achieve what we call the highest standard of excellence, they're eligible for one of our gold awards. So for tobacco cessation systems, it's the gold star. For healthy food environments, it's the gold apple. And for physically active work sites, it's the gold medal. And then once an organization achieves gold across the board, and then they also achieve an A in the Culture of Wellness module, they're eligible for the Excellence Recognition, which is really our overall capstone award. So today we're going to focus on the gold apple and how to meet that standard. So the gold apple is about providing access to delicious, affordable, healthy items in all work sites. So not just making sure that the healthy item is available, but also making sure that it's delicious and that it's affordable, so employees will want to choose it. So the key components that we look for in terms of creating a healthy food environment is access, pricing, marketing, benefits, and education. So I'm just going to talk a little bit about each one of these components. For access, this means that you're making sure that healthy foods are available during all hours of operation in all of your locations. So adopting healthy food guidelines to help you identify and define healthy options, and then implementing a healthy food policy that requires that healthy options are available whenever and wherever food is provided. So that doesn't mean that it has to be 100% healthy, but it does mean that there always has to be a healthy alternative available. Ensuring that vendors provide healthy options during all hours of operation and all of your food service venues. So if you have a cafeteria, if you have a canteen, in your vending machines and at catered meetings. And then training your food service staff on preparation and portion control if you do have food service staff. And then these last two are things that Holly's going to talk a little bit more about, partnering with local farmers to do farmers markets on site or produce delivery, and also implementing on-site gardens. So pricing, this just means pricing healthy items in a way that is going to incentivize employees to purchase those options. So making sure that the healthy options are at least equivalent to the price of the unhealthy, but preferably less than. So there's several ways you can do this. Some employers will choose to increase the price of the unhealthy options just to offset the cost. Other employers might decrease the price of the healthy options and then subsidize that cost. Or there's creative things you can do like having value cards. So buy 5 healthy meals, get 1 free, something like that. And then marketing. So not just making that, the healthy option available, but really drawing attention to it and making it very noticeable and prominent. So ways you can do this are labeling healthy items with nutrition information, or labeling foods that meet your healthy nutrition criteria with a recognizable icon. So if employees aren't able to actually read nutrition information, they can at least see that icon and see that it meets your healthy nutrition criteria. Also using product placement to make healthy options more prominent and accessible. So this means in your cafeteria line, putting the healthy option at the very front, so it's the very first thing that people see. Or if you have multiple food stations in your cafeteria, putting the healthy food station right up front. Putting healthy snack items at eye level, so it's naturally where people's eyes are drawn, and putting those healthy snack items at impulse stations and checkout stations, so people are more likely to purchase them. Also in your vending machines, product placement is really important, making sure you're putting those healthy options in the first 2 top rows and the right-hand column. That's where people are most likely to purchase items. And then benefits, so providing nutritional counseling to all employees regardless of their health status, either as an insurance benefit or an equivalent employee benefit. So what that means is if you're not able to provide nutritional counseling through your insurance benefits, maybe your organization is too small, you could, an equivalent employee benefit would be hiring a nutritionist to come on site once a month to talk to your employees, something like that. So using benefits, design and wellness incentives to encourage behavior change, and then always constantly communicating any nutrition benefits that you have to your employees through multiple channels, multiple times throughout the year. And then lastly, education. Implementing a campaign to promote your healthy food environment to employees and visitors, and then providing opportunities to educate employees about healthy eating through things like lunch and learns, cooking demonstrations, and healthy recipe exchanges. Those can be some really fun, hands-on ways to teach employees about healthy eating. So lastly, I just want to talk really quickly about the importance of food service partnerships. I feel like creating partnerships is probably the most important for this pillar, for the nutrition pillar, more so than any other area, because With creating a healthy food environment, you have to rely on the vendors that you partner with to bring in those healthy options, to price them in a way that incentivizes the healthy choice and markets them in a way that's going to encourage people to purchase them. So you're very heavily dependent on creating good relationships and good partnerships with those vendors. So partnering is important because it increases your chances of success. It's a team effort, so you're not working by yourself. You're not fighting an uphill battle by yourself. And you're combining resources with other partners so you can really get more done and go further faster. It creates synergy and momentum, so it really creates a lot of excitement and it really keeps things moving forward. It's a more streamlined approach, and in the end, it's a more sustainable approach because more people are involved working together. So with that, I just wanted to provide everyone our contact information. I mentioned Jen Wright, our Working Well manager. She's in the web room today, myself, and then two ladies over at Prevention Partners in North Carolina, Lindsay Bickersbach and Kara Vandegrift. A portion of their time is dedicated to Working Well, so you may occasionally see communications from them. But please feel free to reach out to Jen or myself if you have further questions about, going for the gold apple, or if you want to schedule a site visit for us to come out and assess your food environment. We would absolutely love to do that. So with that, I'm going to turn it over to Holly. I'm going to let her introduce herself, and she is going to talk about farm to institution and ways that you can get plugged in. So Holly, I'll turn it over to you.
Thank you, Emily. I am so glad to be here, and I appreciate Emily and Jen including me today because I'm excited to talk to you about farm to institution and the opportunities that may exist with our program at your institution. So farm to institution is a national movement, and of course we want more institutions in South Carolina to join. For instance, New England has a whole coalition of farm to institution participants, and these include hospitals, colleges, child care centers, and schools K through 12. So our mission for farm to institution, well, we want to connect farmers with schools, preschools, hospitals, colleges, and any other businesses or work sites to strengthen our own food system here in South Carolina by having these institutions purchase South Carolina grown and processed foods to be served in their cafeterias.
Can
everyone hear me okay? I saw these
comments that they couldn't hear me.
Holly, I think that some of the folks that were just in the web room maybe weren't able to hear you because I just saw you were muted, but I actually just unmuted you. So
Okay.
You should be good to go now.
Okay, I'm sorry about that. I wasn't sure who could hear me and who couldn't. So again, our mission for Farm to Institution is really just to connect workplaces with farmers and also, like Emily discussed in her previous presentation, provide opportunities for employees to obtain nutrition and agriculture education and be prompted to make the healthy choice the easy choice. And she provided a lot of great examples such as the vending machine and incentivizing healthy purchases. And those are all policies and activities that we support as a part of this program. So our Farm to Institution program, I'm going to give you a little background. We are a collaborative effort between the Department of Health and Environmental Control, the Department of Education, the Department of Agriculture, and Clemson University. We initiated as a 2-year project funded by the Center for Disease Control and Prevention. And initially, our project was really focused on schools, K through 12. So when we were initially funded in 2011, for the past 3 years, we've been focusing primarily on schools, K through 12 settings. However, in the project that was funded, there was always the intent for Farm to Institution in South Carolina, and we want to expand to other institutions. Right now, we're also in child care centers, and we have some institutions, such as the Department of Juvenile Justice, who participate in our program. So we've always wanted to expand, and now that we have some staff and some coordinators, we are able to take this program to the next level and really tailor the program to the needs of hospitals, businesses, and other work sites. So like I explained, our program is a collaborative partnership, and we're a very unique model at the national level because we do involve such a strong state agency partnership. And this is really what makes not only our also forms the foundation for our program. And we have a lot of support because we have a lot of great partners at the table. Department of Health helps a lot with strategic planning. They are represented on our advisory council fund a lot of our mini grants to schools. The Department of Agriculture is instrumental in connecting schools, child care centers, with them to develop contracts to work with farmers, community-supported agriculture programs, when we need help with gardens, when we need more outreach, negotiating and navigating some of the issues that can come up when dealing with local purchasing. They do our evaluation, so they're involved in making sure that we're is the program performing to the extent that it needs to, and opportunities could be to improve the program. And finally, the Department of Education, they're primarily our partners with schools and with food service directors, and we recognize the value of food service directors, and it is these people at the table when not only a school, business, or workplace, our food service be involved in order to make this program successful. And finally, our South Carolina institutions. We're so happy about the work that Working Well is doing in the state, and we want to be a part of it. And Jen and Emily and I have discussed that this type of program is very complementary to much of the work, and so we're excited to offer this new opportunity to workplaces and businesses in South Carolina. So what does local mean? Because we always get this discussion, what is local? And there are a lot of definitions out there discussing local. On behalf of our program, we define it as anything grown or processed, produced in South Carolina. So although we give schools and child care centers the autonomy to make that definition smaller, we have some schools that prefer to purchase locally within 100 miles. For the purpose of our program, we define it as anything grown in South Carolina, because we do have a variety of agricultural production across the state. And so, for instance, in the upstate, we have a plethora of apples available. However, apples cannot be grown in the low country. We want schools across the state or businesses across the state to take advantage of those local apples. So we want them to feel free to work with farmers or distributors who can access apples grown in the upstate and deliver those to schools across the state. So why buy local? Well, buying local is so important. You know, one thing we've always said throughout this program is if we do not create new market opportunities for farmers in this state, they will go away. So it is essential that our businesses, our hospitals, our organizations, our school system, they need to be purchasing local because that stimulates our own economy. It creates jobs, and it helps preserve agricultural space as land, because when we're using the products that are grown in this state, we're encouraging more growth and production of those products. Furthermore, fresh tastes best. We all know that eating an apple that has grown here or a watermelon that was grown here tastes way better than one that's been sitting on the shelf at a grocery store for a week or so. And people are more likely to eat healthy when it tastes good. I know Emily discussed this in our presentation. We want to make healthy foods fun. We want people to see them as appealing. And if it's local, if it's fresh, it's going to be more appealing. And people are going to prefer it as opposed to something that's been shipped in from overseas or across the country. Third, local produce has a longer shelf life because it's delivered to your business or institution quickly after it's been harvested, as opposed to cooler for weeks or put on a truck there when it's almost ready. Finally, increases meal participation in sales. And we have seen this primarily school sites, but I think the same holds true, and research suggests that it holds true in other institutions. The more local produce that is available, more people want in areas, and therefore school sales go up. I'll share an example from our school systems about this, but we recently started a poultry pilot program in which we worked with a local poultry producer in South Carolina. Many of you may know that broiler chickens are South Carolina's #1 commodity. This is where to start, and we found that we branded the chicken sandwich. It was a whole grain breaded chicken sandwich, also grilled, in the school system, and we found that sales of this branded local chicken sandwich instrumentally when it was presented to students, because students liked the buy-in of purchasing locally. This is cool. In South Carolina, it tastes better. We did taste testings of it, and so we really had a lot of enthusiasm around this local product, and therefore sales in that cafeteria sandwich went up. So what are kind of the core components of our program? Well, our first objective is to increase the number of South Carolina products into institutions. So we want as many farmers as possible, whether they be produce farmers, poultry producers, to get their product in businesses and workplaces. Second, we want to provide education to food service staff on procuring and preparing local products. We recognize that there are challenges and there are barriers staff may occur, or that may occur among food service staff when they are trying to enter this new realm of procurement, whether it be procuring from a local farmer, working with their current distributor to purchase from a local farmer, or preparing unprocessed products. And so our program activities, I'll offer some to institutions and schools and child care centers to help ease this transition to a different realm of procurement and also preparation. We want to promote healthy eating through hands-on experiences. So whether it be offering farmers markets at your business or workplace, a community-supported agriculture program, or even institutional gardens. Those are all activities that we support throughout this program and want to help you make happen at your institution. So program activities. Discuss program activities associated with farm to institution. Understand that these are a sample of activities that are all a part of the program. We recognize that not all institutions will be able to implement every activity, so we just give you an idea of all the possible activities you could participate. Of course, our staff is here to help you where you are, should you want to partake in any. So, first activity. We ask that participating institutions serve at least 2 South Carolina products per month to be served in the cafeteria. And this can be produce items purchased from local farmers or your distributor. You can also purchase local poultry, dairy, and other products. And again, we have sample contracts and farmer profiles as guides. And what farmer profiles are these are farmers across the state that have expressed interest in selling to schools, businesses, other organizations, and we do profiles on the products that they offer so that a food service director can look at farmer near him or meet his needs and what activity or what options they offer in terms of pricing, products, and it kind of helps just orient you to what's available in your area. We can also help you work with your food service distributor and work which local farmers that they might be able to purchase from if you want to keep delivery consistent. So we also ask that you promote South Carolina grown in the workplace. If you're participating in the program and you're offering local options, it makes sense that you want to promote these options to those to your employees and other participants. We hope that institutions will be proud of the work doing to serve local products. And for this reason, we help you enroll in the South Carolina Grown program. And this program is run through the Department of Agriculture. And what we do is we provide signage for you to display at your organization. And the pictures that you're looking at, that is the South Carolina Certified Grown sign. So these are all things that you can display in your cafeteria or at your workplace to let employees know that you are promoting and supporting South Carolina grown produce and other products. Like I mentioned earlier, we offer employees nutrition and agriculture activities, and we do this in several different ways. For instance, activities that we encourage institutions to offer could include community-supported agriculture, mobile farmers markets, or even healthy cooking demonstrations. Our program, and you can see in the picture to the right, also offers culinary trainings for food service staff on the preparation of local unprocessed produce. And to make this happen, we partnered with the USC School of Restaurant and Tourism Management and developed a curriculum for teaching food service staff how to prepare local unprocessed products. And we offer half-day trainings on the preparation of this local produce, and we offer seasonal so that you can have a variety of produce depending on what the season is. And so this is one way we like to really engage our food service personnel and get them involved in buying, because if they're excited about the work they're doing and skills, that only goal of serving more local produce and having enthusiasm and support for the program. Finally, we ask revitalize and inspire. And this is the most fun activities that across businesses is this garden aspect. And I'm going to share a couple of examples that some hospitals across the country have done to integrate garden produce into their cafeteria meals. I've put up on the screen our Palmetto Pics of the month, and this is a guide that we have developed, and it's a harvest of the month that we call Palmetto Pics, and you can use this guide to identify which foods to source in your cafeteria or which foods to serve as part of taste testings, taste tests with any employees. These fruits and vegetables are stayed during these months, so you can enjoy fresh, flavorful, just harvested foods at your institution. And we put this together so that food service personnel and other folks would have an idea of what is relevant the year. And although you don't have to purchase these products, sometimes it's nice to know what's available, because there's going to be more availability of these products and it may be easier to obtain them. So, opportunities and examples. I want to take a minute to share some opportunities for farm to institution, and some of these are geared a little bit more towards hospitals, because hospitals have shared a lot more examples, but they can be able to really any business or organization. So this will just provide you with an idea of what are some things you can do as a part of the farm to institution program. The farm to hospital. Well, we believe that food is medicine, and that what you eat has as much to do with your overall health. So the farm to hospital method is one approach to improve health. A recent study from the University of Maryland found that behavior and foods following a healthy foods diet accounts for 70% of one's health, with medical care a mere 10%. So if you're going into the hospital, you're going to get well. You're going there to get well. And one of the main ways you do this is through good quality nutrition. And that's why we think farm to hospital is so important, because we are what we eat. And so if we're trying to achieve an optimal state of wellness or health, the better quality foods we're eating are certainly going to contribute to that process. Second, there is a tax incentive for hospitals. Nonprofit hospitals now have an incentive to invest in food and nutrition programs as part of the Affordable Care Act goal of improving preventative health indicators. This ruling was directed to comply with the Affordable Care Act. Basically, it means that hospitals may be able to claim tax credit for programs to reduce the cost of fruits and vegetables in farmers markets and grocery stores, and prescriptions that substitute healthier foods for medicine, and even help defray the higher cost of healthier meals. And Emily made some suggestions in her about subsidizing the cost of healthier options, and so there's definitely incentive to do this especially for nonprofit hospitals. So I really believe there are incentives across the board for any business or institution. It's just some nonprofit hospitals may be able to claim a tax incentive. Rooftop gardens are another great example, and these have been popping up across the country. This picture here is of Stony Brook Hospital's rooftop garden, and they've really done an incredible. Crops were grown this year. This is the farm's third harvest. Edible flowers turn up on patient salad. Berries were woven into muffins. Cucumbers, turnips, Brussels sprouts, carrots, parsnips, and onion were also grown. They also plant rows of herbs on their garden, and they are garden. The Vermont Medical Rooftop Garden on top of their oncology center. So they use considerable patients' meals, and they also administer a similar poultry pilot program in which they get local chickens and they use that to make their chicken broth that's often given to patients that can only this next slide is actually one that we're going to come back to, and because Jen and Emily and I discussed that it was not possible to the video as a part of the presentation. Participants need to view it. I thought that instead of disrupting the whole presentation, that I would ask that if you would like and watch the video. It's a 6-minute video, and it's a CEO of St. Joseph, their commitment to farm to hospital, some of the efforts they've reaped from this type of program. So I do encourage you, if you have the time, to watch the video and learn a little bit more about the work that they are doing. So one thing I also want to talk about is how we can help you. Our program is here to assist you and meet you wherever you are and whatever your goals may be. So we can help you develop a program to procure locally or to on-site farmers market or a garden. We can help you with education opportunities for employees. We can also help you with farmer and distributor outreach. With farmers in your areas, find farmers that may have products that you are looking for. We also work with farmers and distribution companies about sourcing South Carolina grown produce. So we try to work on both sides. We work at the farmer, hospital, business, school, institution side to sort of meet the needs of participants and link them to one another. Finally, some funding set aside to help hospitals and businesses and other organizations implement some of the program activities that I mentioned. And so at some point, our advisory council is discussing the possibility of offering mini grants. And these would be small grants out to hospitals, businesses, any organization or workplace that wanted to implement some program activities associated with farm to institution. We haven't released an RFP quite yet, but if there is interest in these mini grants, I think it's something that we will consider releasing in the near future. So why is this program so important for South Carolina? Well, by increasing the demand for South Carolina products, we can food and farm enterprise. We can create better jobs and a stronger agricultural economy. And finally, we can provide consistent access to affordable, healthy, locally facilities. So basically, we see this program as a win-win for the health of employees, businesses, and other institutions, as well for our farmers. Again, this is a great market opportunity for farmers. We don't want so much of the product that is grown in South Carolina to be exported. Rather, we want our own business to take advantage of what's grown in the state and use it in their own businesses and workplaces. And so we really feel that by linking these two partners together that we're going to achieve a stronger economy and a healthier one. Currently, it is the South Carolina FarmToSchool.com website because those were our first site and still remain the majority of our participation. However, we have a lot of resources up there that are relevant to care centers, hospitals, other workplaces. And I listed a few things that are available. For instance, we have a farmer contact list. We have a map of farmers that are available. And we also go over what kind of certifications they have. So if you're looking for a farmer that is Good Agricultural Practices certified or an organic farmer, that's indicated on the list. And we can also help you sort through these resources if you reach out to us. Second, we have a garden toolkit available. And this toolkit's really unique because it walks you through the step-by-step establishing a vegetable garden. Thing that sounds so cumbersome, we really break it down and help you do it in a manageable way. You know, I show pictures of rooftop gardens and extensive gardens, and we recognize that not everybody is going to be able to implement that type of garden. So this toolkit shows the benefits of even having a container garden at your work site and how that can help improve nutritional quality of access ways to fresh foods. We also have procurement guides that are helpful for food service personnel in products, and also geared towards schools right now. Some of the principles are certainly transferable, and they can be helpful if you are trying to navigate a new procurement process or if you're unfamiliar of purchasing from local farmers. We spotlight recipes that use local produce, and these recipes are aligned with HACCP guidelines, and they're healthy, they use local produce, and they're simple to prepare. They've all been tested. Many of them were developed by our culinary team at the University of South Carolina, and so we encourage you, if you are interested in using any of our recipes, to give them a try. You to please check out the website if you are interested in any of our resources, and at any time please feel free to contact us with questions that you may have and support you in these efforts. So I'll open the floor for any questions, Emily, Jen, if that's okay, unless you had something you wanted to add before we do that.
No, that's great. I'd love for you to take questions. So if anyone has questions for Holly, feel free to enter them into the chat pod, or if you're on the phone line, you can unmute your phone and ask them over the phone. Okay, it looks like there's no questions for now, but if anyone thinks of questions, Holly and Jen and I will stay in the web room for a few minutes after the presentation, so if you think of questions, feel free to enter those through the chat pod. But thank you so much, Holly. That was really great, and I hope that everyone will take advantage of all the resources and tools and technical assistance that Holly mentioned. And I'm just going to wrap up by mentioning the resources that are attached in the web room if you want to download those and look at those later. But if you notice in the bottom left-hand corner of the screen, there's 5 icons down there. There's an icon that looks like a computer screen. If you click on that, you should see 5 resources attached there for you. You can download those. We have the webinar slides for you, so if you want to go back and look at those at a later time, or if you want to share them with a colleague, those are there for you. And if anyone was unable to see some of Holly's pictures, I noticed that on my end, you can go back and download those slides and look at the pictures there as well. I've also attached the Gold Apple standards, so the standards that I went over earlier in the presentation. There's a one-page handout that just kind of summarizes those standards if you want to take a look at that. There's a document on creating food service partnerships, creating worksite farmers markets and community-supported agriculture programs. And then I've also attached our Working Well 2014 Executive Summary. It just summarizes all the work that we were able to do and all the progress that we made in 2014, so that's there for you as well. And Holly, I think a question came in for you through the chat pod. Oh, and I see that you answered it. So Ken asked, where can we find information on the tax incentive through the ACA? Do you mind answering that over the phone as well?
Sure, of course. So I just I asked him if he wants to email me. What I can do is I can forward you some of the discussion as well as the directive that was emailed to me regarding the tax incentives associated with ACA. It was a significantly long email, so I think it's better if I along as opposed to trying to summarize it, and that way anybody who might be interested can look it up to see if it meets their institution or hospital.
Okay, great. Well, thank you so much, Holly, and I want to thank everybody that was on the webinar today. Thank you for your time. And like I said, we'll stick around if you have any further questions. And I'm actually going to flip back to the video that Holly mentioned. So if anybody wants to stick around and take a look at that, please feel free to do that. Or you can, like I said, download the slides and take a look at that video later. But thank you so much for your time, and everyone have a great afternoon.